When I first heard about Nurse Lina, the AI nurse at the Ministry of Health, I was curious to know how she works and, more importantly, whether she could provide reliable information on family planning. With excitement, I asked a colleague to help me start a conversation with Nurse Lina. Among the questions I wanted answered was one about a family planning method that many people fear: the intrauterine device, commonly known as the IUD. My concerns were not very different from those of many people who have had myths and fears surrounding the method. To my surprise, Nurse Lina provided clear answers to my questions. She also guided me on where to seek further information and services from health facilities. The experience demonstrated how artificial intelligence can provide people with accessible information and help them better understand their family planning options. According to Dr. Daniel Aguma, a pharmacist at the Ministry of Health, the evolution of artificial intelligence is making access to family planning information easier.
This tool is it's a chatbot. It's WhatsApp based. So the way you chat with your friend on WhatsApp is the same way you chat with this AI-powered system that is giving family planning information. And the way AI works is that the longer it continues to interact with people, the more it learns. So today you'll ask it a question, it might not give you the response that you want, but tomorrow it has learned that question and it will use new information to answer the next person better.
He explains that the AI tool provides information based on Ministry of Health guidelines, helping users get answers to common questions and directing them to appropriate health services when they need further assistance.
So the primary information that this AI chatbot is running on is the Ministry of Health guidelines, the document that we have as the Ministry of Health that we have developed over the years to guide family planning service delivery. That is the information that this chatbot is using. So if you ask it about side effects, it will go back into the guideline, pick the side effect profile that you have described, and then give you the management protocol that was prescribed within the guideline for that side effect.
This means family planning information can increasingly be accessed both online and offline, giving individuals an additional avenue to learn about the available services and make informed decisions. However, health experts emphasize that digital tools are meant to complement, not replace professional medical care.
Been notified of the frequently asked questions, so it has answers for those. But where the AI detects that you might need human interface, it also makes that recommendation for you. Like for your case, I think you need to visit a facility.
During a discussion with the Health Journalists Network, health professionals stressed the importance of having accurate knowledge about family planning, particularly for women of reproductive age.
Very happy to partner with BBC and Palladium for us to understand family planning, the commodities, what is available, what is not available, how is it happening in the SRHR space.
Dr. Charles Ebong, Principal Medical Officer, says family planning is not only a concern for women. He notes that family planning information and services are relevant to men, women, and children, making it important for families and communities to have access to accurate information.
For us to achieve what we have put in Vision 2040, family planning is a big component. Not just because it enables you to produce the number of children that you're able to take care of, you're able to educate and able to make them productive, but also for our ladies to be productive. And we are not just talking about men supporting women. We're also talking about how do men receive services for SRH. We know the issue of erectile dysfunction is a big thing, and men there are hiding, yet we can help them. We want every service delivery point to have commodities. We have intentionally increased investment on long-term reversible contraceptive commodities so that every service delivery point can have the commodities.
For the people out there, you need to know that the government, the Ministry of Health, is working tirelessly to try to, as much as possible, make you access at your best convenience.
According to data from the Ministry of Health Uganda and the Uganda Bureau of Statistics shows that the modern contraceptive prevalence rate, or MCPR, among women of reproductive age stands at 29.8%, while the unmet need for family planning has declined to 18.5%. Despite the availability of different modern contraceptive methods, IUDs remain among the least used options in Uganda, accounting for only about 1.1 to 5.4% of the modern contraceptive method mix. Health experts say myths about health risks, pain, and discomfort have contributed to the low uptake of IUDs and other long-acting contraceptive methods. There are also challenges on the provider side, including stockouts and limited numbers of health workers trained to provide long-acting reversible contraceptive services. Experts therefore advise individuals not to choose a family planning method based solely on information from friends, social media, or other unverified sources. Instead, anyone considering a contraceptive method should consult a qualified health professional who can explain the available options, possible benefits and side effects, and help determine which method is appropriate for them. As technology continues to evolve, tools such as Nurse Lina could help bridge information gaps by giving people an opportunity to ask questions privately, access reliable information, and know where to seek professional care. Nagujja Serena for NSTV.